If you've ever looked down at your feet and thought, this is nothing, it will go away on its own, I need you to stop right there. Because what I'm about to tell you could quietly separate two types of people: those who catch diabetes early and those who realize it too late. And here's the shocking part most doctors don't say clearly enough: your feet often warn you before your blood tests ever do. Not your eyes, not your hands, your feet. They are the forgotten messengers of diabetes. And in the next few minutes, you're going to understand the 9 warning signs in your feet that doctors see every single week in patients who had no idea their blood sugar was already damaging their body. Some of these signs look harmless, some feel normal, and that is exactly why they are so dangerous. Let's start with something simple. Have you ever felt a strange tingling in your feet, like tiny electric sparks under your skin? Almost like your feet are asleep even when you're fully awake. Most people ignore it. They say, maybe I sat wrong, or it will go away. But in medical reality, this is often one of the earliest signs of nerve irritation caused by high blood sugar. When glucose stays elevated for too long, it starts damaging the tiny nerves in your feet. This condition is called diabetic neuropathy, and it doesn't wait for permission. It develops silently. And here's the part that surprises people the most: it doesn't always hurt in the beginning. Sometimes it starts with numbness instead of pain. You step on the floor in the morning and something feels off. Not painful, just different, like your feet are slightly disconnected from the ground. That disconnect is not normal aging, it's a signal. Now let's talk about another warning sign that people completely misunderstand: dry, cracked skin on your feet. Everyone assumes it's just weather, soap, or lack of lotion. But when diabetes starts affecting circulation, your skin loses its ability to stay properly hydrated and heal itself. So cracks appear more easily, small cuts take longer to heal, and the skin starts looking unusually rough even if you're taking care of it. This is not just a cosmetic issue, it's your body struggling at a deeper level. And there's more. Have you noticed your feet getting unusually cold, even when the rest of your body feels fine? That can be reduced blood flow. Diabetes affects circulation by damaging blood vessels over time, making it harder for warm, oxygen-rich blood to reach your lower limbs. So your feet become the cold zone of your body, and many people ignore it for years. But the human body doesn't send random signals. It repeats them. It escalates them. And if we don't listen, it gets louder in ways we don't want. Now, before we move forward, understand this clearly. Not every symptom means diabetes, but ignoring them altogether is what creates the real danger. Because by the time pain becomes obvious, the condition has often already progressed. In the next part, we're going deeper into the foot changes that most people only notice when damage has already begun, and what makes them so easy to miss in everyday life. Let's continue. Now, I want you to pay close attention, because the next signs are the ones people live with for months, sometimes years, without realizing what's happening inside their body. And by the time they finally understand, the damage is already advanced. One of the most overlooked warning signs is a burning sensation in the feet. Not sharp pain, not injury pain, a deep, uncomfortable burning, especially at night. People describe it like hot feet or walking on warm sand even when they're lying in bed. And here's the truth most don't know: this isn't a foot problem, it's a nerve problem. When blood sugar stays high, it slowly injures the protective covering of nerves. That damage causes misfiring signals. So instead of normal sensation, your nerves send pain signals without any real injury. That's why it often gets worse at night. When your body is still, your brain has fewer distractions, so it feels the nerve damage more strongly. And many people try to fix it with cold water, massage, or pain creams. But the real issue is internal. Now let's move to another sign that often surprises people: slow healing wounds on the feet. A small cut from walking barefoot, a tiny blister from shoes, even something as simple as a scratch. Normally, your body heals it quickly, but when diabetes is developing or uncontrolled, healing slows down dramatically. Why? Because high blood sugar damages both circulation and immune response. So your body is trying to repair the wound, but it's not getting enough oxygen and nutrients to do the job properly. And this is where things become dangerous, because a small wound that should heal in days can stay open for weeks, and open wounds are entry points for infection. Another major warning sign is swelling in the feet or ankles. At first, it might look mild, just slightly tight shoes at the end of the day, or socks leaving deeper marks than usual. But over time, swelling becomes more noticeable. This happens because poor circulation and fluid imbalance start affecting the lower limbs. And the reason it shows in the feet first is simple gravity. Your feet are the lowest point in your body, so any circulation problem shows there first. Now let's talk about something even more subtle: changes in foot color. Some people notice their feet looking unusually pale, bluish, or even reddish at times. This is not random. It reflects how well blood is flowing through the vessels. Healthy circulation gives your skin a consistent tone, but damaged vessels create inconsistency in oxygen delivery, so the color shifts. Sometimes it's barely noticeable, sometimes it comes and goes, and that is exactly why people ignore it. But your body does not change color without a reason. And there is one more early warning I want you to understand in this part: hair loss on the feet and lower legs. Most people never connect this to diabetes, but reduced blood flow means reduced nourishment to hair follicles. So over time, hair becomes thinner, then patchy, then disappears. It's subtle, it's slow, but it is meaningful. And when multiple of these signs appear together — tingling, burning, swelling, slow healing, color changes — that's when doctors start taking it very seriously. Because it is no longer about one symptom, it's about a pattern. In the next part, we'll go even deeper into the final warning signs that often appear right before complications become severe, and what you should never ignore at that stage. Now we're entering the stage where the warning signs become harder to ignore, but unfortunately, many people still do. Because by this point, the body is no longer whispering, it is speaking loudly. One of the most serious signs in the feet is loss of sensation. And I don't mean a little numbness, I mean not feeling things that should clearly be felt, like stepping on a small object and barely noticing it, or not realizing the water in the shower is too hot or too cold for your feet. This is dangerous for one simple reason: pain is protection. When you lose sensation, you lose that protection. And this is exactly how small injuries turn into serious infections without the person even realizing it. In medical practice, this is one of the biggest concerns in long-term diabetes cases, because unnoticed injuries are the starting point of complications. Now let's talk about another warning sign that often shocks people when they hear it: foot deformities or changes in foot shape. This doesn't happen overnight, it develops slowly. Bones, joints, and tissues in the feet can weaken over time due to nerve damage and poor circulation. The result? The structure of the foot can begin to change. Toes may curl slightly. The arch may feel different. Pressure points shift, causing unusual discomfort when walking. Many people blame shoes or aging, but in reality, it can be the effect of long-term uncontrolled blood sugar damaging deeper structures. Now here's another important sign: recurrent foot infections. If you find yourself getting infections repeatedly in the same area, or small cuts turning into red, inflamed spots more often than before, that is a serious red flag. High blood sugar weakens the immune system. It becomes harder for your body to fight bacteria, so even minor skin breaks can turn into infections that return again and again. And the problem is not just the infection itself, it's the cycle. Infection, partial healing, reinfection. That cycle slowly damages tissue over time. Now let's move to a sign that many people completely underestimate: thickened or discolored toenails. Toenails may become yellowish, brittle, or unusually thick. People often assume it is a fungal issue only. And while fungus can be involved, poor circulation and weakened immunity from diabetes make the nails more vulnerable in the first place. So what looks like a simple nail problem can actually be a deeper metabolic issue. And here is another subtle but important warning: sharp changes in foot temperature from one side to the other. One foot may feel warmer than the other, or one may feel colder without a clear reason. This uneven temperature can indicate circulation differences between limbs. Healthy blood flow should be relatively balanced, but when vessels are affected, that balance gets disrupted. Now I want you to understand something very important. None of these signs alone confirm diabetes, but they should never be ignored either. Because diabetes is not a sudden condition, it builds silently, step by step, signal by signal. And by the time severe symptoms appear, the body has already been struggling for a long time. In the next part, we will connect all these warning signs together and reveal what doctors actually look for when they see these patterns in real patients, and what you should do if you recognize even a few of them. Now I want you to see the bigger picture, because this is where most people make a dangerous mistake. They look at each symptom separately: a little tingling, a bit of dryness, some swelling, maybe a slow healing cut, and they tell themselves, it's nothing serious. But in medicine, we don't just look at symptoms, we look at patterns. Because diabetes rarely announces itself with one loud warning. It builds a combination of small signals that quietly point in the same direction. So let's connect what you've learned so far. When tingling starts appearing in your feet, when burning sensations begin at night, when numbness replaces normal feeling, that is nerve involvement. When cuts take longer to heal, when infections keep coming back, when skin becomes dry and cracked, that is circulation and immune system involvement. When feet become cold, when color changes appear, when hair starts thinning on the lower legs, that is blood flow involvement. And when swelling, nail changes, and structural discomfort show up together, that is deeper tissue stress. Now imagine all of these happening at the same time, not in dramatic form, but slowly, quietly, over months or even years. That is how diabetes progresses in real life. And here's what doctors are trained to recognize immediately. It's not just the symptom, it's the clustering of symptoms in the lower limbs, because the feet are often the first place where long-term blood sugar damage becomes visible. Now let's be very clear about something important. Seeing these signs does not mean you should panic, but it does mean you should not ignore them, because early detection changes everything. In early stages, lifestyle changes, diet adjustments, and proper medical guidance can significantly slow or even prevent complications. But in later stages, when nerve and vessel damage becomes advanced, recovery becomes much harder. That is why awareness is so powerful. Now I want you to think about something many people overlook. How long have these signs been slowly developing in your body? A few weeks? A few months? Or longer? Because diabetes doesn't usually appear suddenly. It gives time. It gives warnings. It gives chances to act. But only if you are paying attention. And the truth is, most people are distracted by daily life. They notice symptoms, but they don't connect them. They feel changes, but they explain them away. I'm just tired. It's just age. It's just stress. And while they are convincing themselves it's nothing serious, the condition continues quietly progressing. Now at this point you might be wondering, if I recognize some of these signs, what should I actually do? The answer is simple, but important. Do not self-diagnose, do not ignore, and do not wait for symptoms to become severe. The correct step is to get proper medical testing, especially blood glucose evaluation, and discuss your symptoms with a healthcare professional who understands metabolic conditions. Because feet are not just for walking, they are early warning indicators of what is happening inside your body. And if your feet are speaking to you now, it means your body is asking for attention before it becomes a bigger problem. In the final part, we will go over the most important takeaway from everything you've learned, and the simple mindset shift that can protect your health going forward. If you've watched this far, there's something important you need to understand. This is not just about feet. This is about awareness, because your feet are not the problem. They are the warning system. And the real question is, are you listening early enough? Most people only react when life forces them to, when pain becomes severe, when walking becomes difficult, when infection becomes obvious. But by that point, the body has already gone through a long, silent struggle, and that is the real danger of diabetes. Not that it appears suddenly, but that it develops quietly while life continues as normal. Now let's bring everything together in a simple way. If you notice tingling or numbness in your feet, that is nerve stress. If you notice burning sensations, especially at night, that is nerve damage progressing. If you notice slow healing wounds or frequent infections, that is weakened immunity and poor circulation. If your feet feel cold, look discolored, or change tone, that is reduced blood flow. If swelling appears, nails become thick or discolored, or walking feels different, that is deeper tissue involvement. And when these signs start appearing together, not just one, but several, that is when your body is clearly signaling that something systemic may be happening, not just a foot issue, a whole body issue. Now here is the mindset shift that can change everything for you. Stop thinking in terms of fear. Start thinking in terms of signals. Your body is always communicating. The difference between health complications and early prevention is not luck, it is attention. The earlier you respond to signals, the more control you have over outcomes. And this is why doctors emphasize awareness so strongly. Because diabetes is one of those conditions where early lifestyle changes can make a massive difference. Better food choices, regular movement, hydration, sleep quality, medical checkups. These are not complicated steps, but they are powerful when done early. And one more thing you must remember. No online video, no script, no list of symptoms can replace proper medical testing. This information is meant to guide your awareness, not replace diagnosis. If you recognize patterns in your own body, the smartest thing you can do is take that information seriously and act responsibly. Not tomorrow, not someday, but when your body first starts speaking. Because your health does not wait for perfect timing. It responds to the decisions you make today. So if your feet have been trying to tell you something, don't ignore them anymore. Listen early, act early, and give your body the attention it has been asking for before small signals become serious problems.